Hi, everyone. Let's discuss 4 science-backed ways to reduce bloating. Certainly one of the least pleasant digestive side effects to experience, this feeling of gas, pressure, distension, discomfort. And again, thankfully, there are a number of things that you can do naturally to improve bloating. In fact, I'll share with you some evidence showing that natural agents have been found as effective, if not more effective in some cases, than pharmaceutical drug intervention. So especially if you're someone trying to resolve their bloating with the most minimally invasive therapeutics, I'm excited to share with you what you can do about your bloating, flatten your stomach, and improve how you feel. So let's jump in. Welcome to Dr. Ruscio Radio, providing practical, science-based insights into health, exploring the importance of nutrition, lifestyle, and gut health through conversations with experts, research reviews, and personal stories. We break through the bias and the noise to bring you simple, trustworthy information that matters. Firstly, just to define bloating, this can be a feeling of distension, an appearance of distension, or the two. And oftentimes this will be accompanied by fullness, pressure, pain, discomfort. And bloating occurs in about 31% of the US population, and it's twice as common in females. It's also probably not surprising that bloating has a high association with other digestive symptoms like those found in IBS. Up to 90%, in fact, of those with IBS, irritable bowel syndrome, have bloating. There's also a correlation between small intestinal bacterial overgrowth, celiac disease, inflammatory bowel disease, constipation, and indigestion, which really shouldn't be surprising. And this is a good lead-in to the 4-component model that I think through bloating, and it also gives us some instruction in terms of what do we do first, potentially second, potentially third, and potentially fourth. And before we go there, I just wanted to encourage you to comment. I really enjoy the back and forth and hearing about what you've tried, what you want to hear more of, and also like and subscribe so that you'll see more of our videos in the future. Okay, so here we come to the way I organize my thinking regarding bloating, because one of the things I think many, if not all, healthcare consumers want to have is a plan and not feel like it's kind of this whack-a-mole. I try this, I try that, I hear about this, and so I give a trial on the other thing. But rather, can we organize the causes into a linear plan of support? And that's what I've put together for you here. First, imbalances in the microbiota and leaky gut. These, in my mind, tend to occur together. So whether it be SIBO, small intestinal bacterial overgrowth, dysbiosis, imbalances in the bacteria, or leaky gut, again, the imbalances in the bacteria and leakage or permeability tend to occur together. So this is why on the map here, the first thing we should address are imbalances in the microbiota and leaky gut. Now, second to that is food intolerances. Well, hang on a second. I've often said food first. Is this a deviation from that? Not really. So let me explain what I mean by this. In this case, food intolerances, my position, should be addressed second. And this is because it is the imbalances in the microbiota and or the presence of leaky gut that can lead to the food intolerances. So the most upstream or the most causal intervention would be those targeted at the microbiota and leaky gut. And I'll share with you in a moment data that shows us food intolerances can improve if we successfully intervene at the level of the microbiota. And some of this is quite straightforward. For example, if you're someone who's noticed that high fiber, high carb foods tend to bother you, high prebiotic foods like broccoli, cauliflower, avocado, maybe apples, or maybe raw salads, it's possible that it's not truly the foods, but it's the imbalances in the microbiota that are excessively fermenting those foods, because bacteria eat what we don't digest, and that's okay. But if there's too much bacteria, there can be excessive fermentation and gas release. That gas causes pressure, pain, and can also skew the regularity of your bowels. Not only that, we know that when there's damage in the lining of the gut, that the lining of the gut releases enzymes. When that lining is damaged, this can decrease the amount of enzymes you release. And I'll share with you a study that has documented you can improve at least dairy tolerance when successfully intervening upstream at the level of the microbiota. So for all these reasons, yes, we want to have a reasonable diet, but I would say the fine tuning of the diet should probably be left to point or position 2. And then thirdly here are motility issues. And the same concept and thinking applies. Now, motility, just to define it, is the speed at which foodstuff moves through and then out your intestinal tract. If you're too slow, you're constipated. If you're too fast, you have diarrhea and loose bowels. Now, we know that things like SIBO can lead either to a rapid transit or a slow transit. And thankfully, correction of these imbalances, like but not exclusively or limited to SIBO, can correct motility. So before we overly focus or directly focus on motility, we should be looking at the level of the microbiota and leaky gut first. And then fourth and final to this is pelvic floor dysfunction, meaning that the causal factor may be more so at the level of the musculature. Now, oftentimes, someone may say, well, I look like I'm 6 months pregnant. There's got to be a muscular component to this. And that is true. But the muscles may not be the causative factor. The muscular dysfunction or the distension might be downstream to what's happening with the microbiota, leaky gut, food choices, and motility. So it's much easier, I think, to pinpoint if muscular issues are the true cause once we've worked through items 1, 2, 3, and 4, or 1, 2, and 3 before we go to 4. And thankfully, there's a lot of overlap with how we do this, so it's actually not too involved or too laborious. But this is the model through which I think we should organize our thinking and our interventions as they pertain to bloating. Microbiota and leaky gut first, food intolerances second, motility issues third, and potentially pelvic floor dysfunction or issues with the musculature fourth. And we'll come back to and I'll explain in a little more detail what you should be looking for to delineate or throw up a flag that pelvic floor dysfunction might be present. Okay, so coming back to and working through our model, what can we do to rectify these very important imbalances in the microbiota and leaky gut? I think the best therapeutic to start with, certainly one of the most well-studied, would be probiotics. And I wanted to share with you 2 studies that support my position on this. Firstly, demonstrating how successful probiotics are in the treatment of SIBO, a 2017 meta-analysis from the Journal of Clinical Gastroenterology. They summarized 18 studies looking at probiotics next to placebo. And they found, and I'll quote here, the SIBO decontamination rate achieved with probiotics alone was 53.2%, which was comparable to that observed in a meta-analysis on antibiotics at 51.1%. So again, what they're saying here is that probiotics are as powerful at correcting or eliminating SIBO as antibiotics, most namely the FDA-approved antibiotics, rifaximin. Both are viable, but I would certainly prefer probiotics first instead of antibiotics. Now, what about leaky gut and dysbiosis? This is a study that I was very excited when I saw it published this year. So 2023, meta-analysis from Frontiers in Immunology. They summarized 26 randomized control trials in over 1,800 patients. And what they found was that probiotic supplementation corrected microbial homeostasis. Homeostasis meaning things are balanced and correct. So the microbes, the bacteria, fungus, when they're at homeostatic levels or homeostasis, are balanced. And when they're not, you have dysbiosis or imbalance. So in this wonderful diagram, again from Frontiers in Immunology, probiotic supplementation corrected or led to the achievement of microbial homeostasis. This repaired the intestinal barrier as measured by direct leakage of what's known as LPS or lipopolysaccharide, bacterial fragments, and via a parallel measure known as serum or blood zonulin, as well as leading to a reduction of inflammatory cytokines, TNF-alpha, interleukin-6, and C-reactive protein. So 2 great evidence points. The first for SIBO, the second for leaky gut and dysbiosis, showing us how powerful and simple the intervention of probiotics can be for correcting your gut health. So certainly wanted to make sure that you're aware of this. Now, what about bloating specifically? Well, thankfully, there are other data, in fact, 4 meta-analyses that have found probiotics are beneficial for bloating. I should also disclose and be careful and cautious to share that not every meta-analysis has found probiotics are helpful for bloating. Many times in a field of study, there will be some studies showing benefit, other studies not showing benefit. I still think if you have bloating, one of the best things you can do for all the reasons we just outlined was a therapeutic trial or is a therapeutic trial on probiotics. So this begs the question, well, what protocol should I use? This is the evidence-based sort of meta or big picture protocol that is not limited to the use for bloating. And by the way, before you do anything, always check with your doctor or your healthcare provider. But here is what we recommend. Using one type of probiotic, which is a blend of lactobacillus and bifidobacterium species. If you look on the back of the label, you'll see various types of lactobacillus and or bifidobacterium. Usually anywhere between 5 and 15 various types will appear on the label at a dose of 10 billion. But in clarifying something that's been confusing to some of you, and I'm grateful for the comments to help me see this, higher is okay. Many formulas, including the one that we use in our clinic, will have a higher dose. The minimal effective dose is 10 billion per day. Some studies are using dosages that are quite higher than 10 billion. So you can use more, but if you're looking for the minimal effective dose, that would be 10 billion. And a minimum duration of 2 to 3 months. To be careful, this does not mean you won't see any benefit until the 2nd or 3rd month. You should, in my opinion here, see some sign of benefit within the first 30 days, but you may not see peak improvements until the 2nd or 3rd month. So the minimal duration, in my view, which has been informed from a fairly robust examination of the science, would be 2 to 3 months, with indications it's working along the way. Now, there's 2 other general types of probiotics you can use. Saccharomyces boulardii at a dose of 10 to 15 billion per day for 2 to 3 months. Or you can use a soil-based probiotic at a dose of 2 to 6 billion per day for 2 to 3 months. Now, the Saccharomyces will say on the ingredient label, Saccharomyces boulardii. Very simple. Soil-based will usually have one or a few bacillus type bacteria in the formula. So that is your protocol. Now let's come over to food intolerances, right? Because this is the second point. Coming back to what I mentioned a moment ago, a 2023 meta-analysis, meaning a summary of clinical trials, found that probiotics improve dairy tolerance or lactose intolerance specifically. And to quote the paper, the administration of probiotics was effective at improving adult lactose intolerance, and it is expected that the results of this study could help improve the nutritional status of adults by increasing their consumption of milk and dairy products in the future. So pretty clear evidence that at least as it pertains to dairy tolerance, probiotics can improve food tolerance. What dietary changes specifically should you make? There are a number. I think the best change that will have the highest yield for bloating specifically, outside of just cleaning up your general food quality and mitigating processed food, would be a low FODMAP diet. And here's my evidence for that position, a 2022 meta-analysis in the journal Gut, summarizing 13 clinical trials, looking at the low FODMAP diet compared to standard IBS dietary guidelines, which are essentially to clean up food quality, avoid things like spicy food, excessive levels of caffeine. And here's what they found. Low FODMAP diet ranked first for abdominal pain severity, abdominal bloating, or distension severity and bowel habits. We've done a video outlining all of the therapeutic effects of the low FODMAP diet here, and we will also include a link to a few low FODMAP diet handouts. There's confusion regarding when people search online for a low FODMAP diet, and this is because you will sometimes see different perturbations. If someone is a, let's say, paleo diet advocate, they will oftentimes impose onto the low FODMAP diet additional paleo rules. So we've developed 3 handouts to help you with this. A, paleo low FODMAP diet. And this is for people who are trying to adhere to essentially an elimination diet and low FODMAP at the same time. Second to that would be a standard low FODMAP diet. This is a unadulterated low FODMAP diet, so to speak. And then thirdly, a vegetarian low FODMAP diet for those who are trying to eat on that sort of diet plan. I want to be careful to say, this is not the only dietary option. You can make an argument for paleo, potentially autoimmune paleo, potentially low histamine, and even something like Mediterranean or carnivore. All of these would help, and for certain people, they could help. And without going through sort of an exhaustive narrative on the nuances of diet, I think a good starting point to get you the highest likelihood of resolution of bloating with the minimal amount of dietary restriction, I think low FODMAP would be a good starting point. Now, coming over to motility. Again, I wanted to make sure to share with you the data on probiotics, trying to keep this simple and have the fewest number of interventions possible for the maximal therapeutic gain. 2020 meta-analysis in the journal Clinical Nutrition. They looked at lactobacillus and bifidobacterium blend type of probiotics, like we outlined in the meta protocol, and they found that probiotic supplementation over placebo improved bloating, stool frequency and consistency, and also motility, improving motility by 13.75 hours. Now, you saw in the meta protocol, we recommend a blend of lactobacillus and bifidobacterium bacteria. And this is because, in part, data like this one study on bloating or this meta-analysis on bloating found that a multi-strain, meaning different bacteria, was better, superior to a single bacteria formula. All the data here don't agree, but I think there's a compelling enough trend to suggest we want to be using a multi-bacteria product rather than a single species or single bacteria formula. There are a few other techniques for hydration I wanted to touch on just briefly. Hydration, if you're not drinking enough water, then the fiber in your diet may get compacted and lead to compacted stool and therefore contribute to constipation. This is why the National Academy of Medicine recommends 13 cups, 8 ounces for men per day, and 9 8-ounce cups per day for women to make sure you're getting an adequate hydration. So don't forget about this. Stress is also something that is important, including chewing your food thoroughly and eating slowly. And just to quote a paper from the journal Integrative Medicine, mindful eating offers a scientifically proven, effective way to help regulate the stress response for optimal digestive function, which is the cornerstone of wellness and survival. So don't forget about stress reduction, which is not limited to mindfulness while eating. Here is one that I found to be very important, and I'm excited to share with you. From the journal Gastroenterology and Hepatology, they looked at 94 patients with bloating. Half of the subjects were advised on a post-meal walk. The other half were given a prokinetic or pro-motility drug. After 1 month, the group simply taking a walk after a meal had greater improvements in bloating than did the group getting the prokinetic drug. To quote, minimal exercise or walking after meals is as effective as prokinetic medication, and for relieving bloating symptoms, the intervention or walking was superior to prokinetics. So don't forget how powerful simple things are, like taking a short walk after a meal. So to wrap this up, mindful eating, potentially therapy if there's a big stressor in your life, taking a walk after meals, and if you can walk in nature, that has been shown to have extra benefit on dampening what in some people is an overzealous limbic system, which is a major governor of the stress response. So much power is in your hands with simple techniques. Now, the final point here in the 4-component model is biofeedback for the pelvic floor, or just addressing the pelvic floor musculature. In some cases, what can happen is the sphincter muscle remains closed, and the muscles that are supposed to contract and propel stool out of the rectum so you can have a bowel movement don't contract. And so biofeedback, and big credit to gastroenterologist Satish Rao, who has been on the podcast in the past to talk about some of the research he's pioneered here in demonstrating that you can retime or re-educate the muscles to allow the contractile muscles to push the stool out to contract and the sphincter muscles to relax. That's one application. And especially if you're noticing constipation or labored bowel movements, a technique that you should think about, getting biofeedback therapy for. Now, here's a 2022 study from the journal Neurogastroenterology and Motility. They looked at patients with severe bloating that were not responsive to IBS dietary guidelines. They all underwent pelvic floor biofeedback. All subjects had at least 50% improvement in bloating. Pretty remarkable. Now, there can be another component to this also, wherein if someone has developed muscular imbalances, especially, and this is just a loose representation, but if someone has a pelvic floor, so your pelvis, that's tipped forward or known as an anterior pelvic tilt, and they're experiencing weakness or inhibition of the abdominal wall muscles, this can be a postural issue that develops over time if there's excessive sitting. And also, even if you are exercising, but your exercise routine is not optimally balanced, you can develop weaknesses in some of the muscles on the front side and back side of your body that need to be in balance so as to prevent your pelvis from tipping forward and that inhibiting your abdominal wall. And we'll include a few resources for where you can look into finding a pelvic floor therapist to help you with this. pelvicrehab.com, pelvicpainrehab.com. And you can also look for someone who does pelvic floor biofeedback therapy. Remember, this would be the last component in the 4-component model, but for some people it can be very helpful. So in close, and to wrap this all up, the first component is microbiota and leaky gut. And not the only therapeutic here, but I think the one for which you will have the highest bang for your buck would be probiotics. Second component, food intolerances. Again, probiotics may actually help to correct the food intolerances so you don't have to narrow your diet. Not an excuse to eat poor quality foods, but could help you have more food freedom. And second to that, not the only diet to consider, but I would cast a strong vote for a trial on the low FODMAP diet, given the evidence. Third to this would be motility. Again, probiotics can be helpful, as can hydration, stress management, and pretty remarkable, the impact of simply walking after a meal. And then if you've done all of these things and you're still struggling, you may want to check in with a pelvic floor therapist or undergo pelvic floor biofeedback therapy. All of these techniques are natural, non-invasive, not very expensive, and science-backed in their ability to improve your bloating. So I hope you will try some, if not all of these. Again, make sure to check in with your healthcare team before you do. But please let me know how it goes. I'll be curious to hear. This is Dr. Ruscio, and I hope this helps.